today's video, I'm going to share a simple $5 hack that I use myself and I also use with my patients to help ease their sciatica and hip pain. Now, the reason this is important is that far too often I see people reaching for pain medications at the first sign of sciatica and hip pain. Now, I realize sometimes pain relief is necessary. However, it's always better to get to the root cause of the problem, and in today's video, I'm going to show you how to do that. I'm Dr. Rob from Westside Family Chiropractic in Peterborough. For 24 years, another year under my belt, and over 100,000 patient visits, I've been helping people manage and get rid of their pain. Sciatica and hip pain can have many causes, from arthritis to bulging discs to stuck and stiff joints in the spine due to tight muscles in your pelvis and low back. Regardless of the cause, spinal experts recommend a minimum of 6 to 8 weeks of conservative care before you even consider surgery. In my experience, the most common cause of sciatica and hip pain is stuck and stiff joints in the low back and the pelvis. The good news is that both these areas respond well to self-massage, and an easy tool to use is this $5 tennis ball. Now, I prefer to use this spiky ball, but a tennis ball and even a lacrosse ball works well too. Quick side note, if you use a spiky ball against a wall in your house, it can damage and mark the drywall, which will put you in the doghouse with your spouse. There's 3 areas that you want to work on. Now, quick heads up before you get started. It's okay to feel some discomfort. However, if you find the pain too intense, then lighten up your pressure or work around the area. The first area you're going to work is the muscles along the side of your low back. So you're going to use the crest of your pelvis as a landmark, and then your rib cage as the top. You're going to get that area just between the rib cage and the crest of your pelvis, the muscle group right in this area here. Stand with your back flat up against the wall and use your body weight to push back against the ball. Search for those tight and tender spots. Move up and down, even a little side to side until you find the sore spot. When you find a tender area, hold the pressure on it for about 20 to 30 seconds. You can even roll the ball over it and wiggle over it as well. The second area you're going to work is right along the edge of one of your pelvic joints. So you're going to come in, you're going to find the edge of your tailbone here, and you're going to work right along this area through here with that tennis ball. Stand with your back flat against the wall and use your body weight to push back against the ball. Search up and down about 5-10 centimeters looking for those tender areas. When you find a tender area, hold the pressure on it for about 20 to 30 seconds. You can even roll the ball over it and wiggle it over as well. The third area to work is deep in the buttocks muscle, right down in this area here. Now this is a key player when it comes to sciatica and hip pain, so you might have to dig to get down in there. You're going to use the edge of your hip bone right here as your reference point, and you're going to come in to this area here, and you're going to work right in around there, digging deep to get that ball down in to that area. For this area, come in at about a 45-degree angle. You may need to use a little more pressure as we want to get deep down into the buttocks. Work the area deep in the middle of your butt, up and down, and in and around in circles. When you find a tender area, hold the pressure on it for about 20 to 30 seconds. You can even roll the ball over it or wiggle over it as well. Many people will start to see relief in about 2 to 3 days. It may take upwards of a week before you start to notice some changes. You can perform these exercises 2 to 3 times a day. As always, the key is to start gently and slowly build your way up. If you're not seeing results with these exercises, then an examination by somebody like a chiropractor would be a great idea. As I mentioned, I've been helping people with sciatic and hip pain for over 20 years. You do not have to put up with your pain. If you'd like some help, give us a call, 705-741-2225. That's 705-741-BACK, and Adele will set up some time for us to help get you out of pain. I'm Dr. Rob. See you next time.